Non-alcoholic fatty liver disease is a growing concern, especially for postmenopausal women. Today we break down the causative factors. You're listening to Menopause Natural Solutions. This is episode 138, Non-alcoholic fatty liver disease, part 1. Welcome to Menopause Natural Solutions, your podcast for all things perimenopause, menopause and beyond. Stay tuned as your host, naturopath Jennifer Harrington, explains how to use natural therapies to find your ultimate health and happiness during your transition. Hello ladies! Today I want to discuss with you non-alcoholic fatty liver disease, or I'm going to call it NAFLD for short. I put some time aside yesterday to research and record this episode, but after reading a few research articles, I really wanted to sleep on it. I'm not sure if anyone else does this, but I find it really helps me to process information by sleeping on it. I felt the need to leave some time as there is some conflicting information that may worry some of you. So what I'm going to do is to present the data that everyone agrees upon, mention the variables, and then focus on prevention and treatment. With this being such a big topic that affects so many women, I've decided to split it into 2 episodes. So today is about the causative factors, and next week will be more about the prevention and possible treatment. I hope that sounds good to you. Let's go! Non-alcoholic fatty liver disease is a chronic progressive disease that develops as a result of excessive accumulation of triglycerides in the liver in the absence of excessive alcohol consumption. It affects roughly 30% of the population, which is huge. This is based on a 2019 global systemic review and meta-analysis involving over 5 million people. What is scary is the speed of increase with this upward trend, especially for women. The general prevalence is higher in men than women, but this trend is rapidly changing, especially for postmenopausal women. The peak age for diagnosis in women is in between 60 and 69. The other alarming change is that women are not only developing this disease more often, but they are also progressing through the stages faster, with a higher need of a liver transplant and an increased mortality rate overall. In case you are wondering, there are 3 stages. These stages are assessed by looking at how many hepatocytes or liver cells contain visible triglycerides. It is considered normal to have under 5%. Grade 1 is 5 to 33%. Grade 2 is 34 to 66%. And grade 3 is severe and is greater than 66%. If you qualify and are lucky enough to receive a liver transplant, NAFLD reoccurrence is common and can be present in 3/4 of the recipients. So you can see it's all about the terrain. If you continue with the dietary and lifestyle factors that produced a fatty liver in the first place, replacing it may give you some more time, but ultimately it doesn't solve your problem. What is agreed upon is the link with both the rising obesity epidemic and the diagnosis of type 2 diabetes. More than half of the postmenopausal women with type 2 diabetes also have NAFLD. Heart disease also falls under this umbrella. It may be a two-way street, with low HDL cholesterol levels having a plausible role to play. But after my reading yesterday, it sounds like it's more likely to be a part of the disease progression. So everyone agrees these 3 organs are intimately linked together. A weakness in one area increases your risk of issues in the other organs. These 3 organs being your pancreas, your liver, and your heart. So why the increase in diagnosis for postmenopausal women? Many studies implied it must be the reduction in estrogen that is causing this. Estrogen is thought to slow the progression by suppressing inflammation improving mitochondrial function, alleviating oxidative stress, insulin resistance, and fibrogenesis. The role of estrogen is also linked with metabolic changes and the increase in both the diagnosis of diabetes and heart disease. This is where the conflict in the research lies. If estrogen is the causative factor, you would think that taking hormone replacement may be the answer, but this may not be the case. It may actually increase your risk. This is very controversial. The jury is out here. More research is definitely needed. You can see why I slept on it. Let's briefly chat about a study that pointed to an increased risk. This study is called the Association of Endogenous Sex Hormones with Fatty Liver. You'll find a link to the study in the show notes. They understood that circulating sex hormones change our ability to metabolize glucose and store fat. They also understood that more hormonal changes occur with menopause than just estrogen reduction. They also looked at testosterone, DHEA, and sex hormone binding globulin. This study involved 2,835 postmenopausal women, which is a decent size. They found that having lower levels of estrogen is protective against the development of NAFLD compared to higher levels of estrogen. The form of estrogen they measured in this study was estradiol, or E2. E2 is the main form of estrogen produced by the ovaries in fertile-aged women and found in most menopause hormone therapy, but not the main form produced by a woman who has naturally transitioned into menopause. This form is estrone, or E1. This form wasn't measured in the study. The other findings mentioned in this study include an increased risk with having lower sex hormone binding globulin, lower DHEA, and increased testosterone. These findings link these results with other studies that found women of reproductive age who had polycystic ovarian syndrome are also at an increased risk of fatty liver, as this hormone pattern, especially the increased testosterone and lowered sex hormone binding globulin, match these findings. Just to summarize, they found lower estradiol, lower testosterone levels may be protective against developing non-alcoholic fatty liver disease, while having higher sex hormone binding globulin and DHEA is seen to be protective. For those who haven't heard of sex hormone binding globulin before, it is a globulin produced by the liver that binds to sex hormones, especially estrogen and testosterone. You may have seen in your blood work before a result for free and total hormones, and these numbers will be different. The free hormone is the active hormone. The total figure includes the free hormones plus the bound inactive hormones. Sex hormone binding globulin is the difference. So when sex hormone binding globulin goes down, estrogen and testosterone numbers go up. This is where I love being a nutritionist. Would you be excited if I told you there is a cheap, easy to find everyday food that helps to increase your levels of sex hormone binding globulin? But you'll have to tune in next week to hear about possible treatment options. What you need to take away today is that insulin plays a controlling role in the production of sex hormone binding globulin. The higher your insulin levels, the lower your sex hormone binding globulin. As discussed before, insulin and blood sugar dysregulation also increase fatty liver. Can you see it's all connected? One of the joys of being a naturopath is looking at the body as a whole and joining the connecting dots. You need to address the elephant in the room, insulin. How can you improve your insulin sensitivity and reduce your overall insulin production? It may start with increasing your exercise. Maybe you take a daily walk. It may start by removing and reducing sugar and other processed foods. Maybe it starts with adding more protein and better quality fats to your diet. I really hope you understand the difference between good fats and bad fats, as increasing good fats may actually be part of your solution. Maybe you stop snacking. Maybe you start a nutritional supplement or a pharmaceutical medication. But you need to start here. Next week I'll build on this and add further steps. It is my professional opinion that elevated insulin levels and reduced insulin sensitivity is the starting point. It is the reason many start gaining weight. It is the difference between having normal blood sugar readings and prediabetes and its progression into type 2 diabetes. It is the reason why sex hormone binding globulin lowers. And there's one more thing. Higher insulin levels may also increase uric acid levels. Elevated uric acid has been found to be yet another independent and significant risk factor in the development of non-alcoholic fatty liver disease. If you're wondering if this is the same uric acid as the one linked to gout, yes it is. It is the natural waste product from the digestion of food that contain purines. That's all for today. I truly hope I haven't overwhelmed you. Today is the tricky science. Next week will be the easier to understand next steps. As always, I'm here to guide you through personally. If you would prefer to book a consultation, I would love to help co-create a unique treatment plan just for you. Well, that's it. Until next week, bye for now. Thank you for listening to Menopause Natural Solutions. This podcast contains general information about menopause. It is provided as a guide and it is not intended to replace medical advice. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. If you have enjoyed today's episode, please share it with a friend.